One of the other cancers that we treat is ovarian cancer. So this is cancer that starts in the ovaries or the fallopian tubes or sometimes the lining of the abdomen. They're all kind of grouped together. It's probably the one that when people hear about it is the scariest because
I think so too.
Yeah, it used to really be considered almost a death sentence, but probably in the last 5 to 10 years we've come very, very far with new treatment options, new medications, and how we treat it, and so that's no longer really the case. It's estimated that about 1 in 70 women will get ovarian cancer. And unfortunately, it's a cancer that oftentimes isn't diagnosed until later stages because the symptoms of it are very nonspecific. It's, you know, bloating, abdominal discomfort, kind of feeling full early, so very vague symptoms that a lot of people may write off, and even sometimes healthcare providers may write off if you're not persistent about saying, hey, you know, this is not normal for me. Like let's look into this more.
And does it tend to affect older women, or can it run the gamut age-wise?
Usually it's probably women mostly in their 60s to 70s. The exception would be that there are genetic syndromes that are associated with an increased risk for ovarian cancer. So, you know, everybody's heard about Angelina Jolie, and she has BRCA mutation, which most people know causes breast cancer, but it's also associated with ovarian cancers. And there's other genetic syndromes as well that can increase that risk, and that will usually happen in younger women potentially.
And I know we were going to talk about risk factors as well, so we'll get to that. And then, I'm sorry, Dr. Menzies, you were going to do vaginal and vulvar?
And cervical cancer.
Cervical,
okay. Yeah. So of those, kind of the most common is going to be cervical cancer. That affects about 14,000 women in the United States annually in terms of new cases. It's probably the 4th most common cancer affecting women worldwide. And in contrast to ovarian cancer, we actually have some good screening tests for it. The Pap test.
The Pap smear is
exactly.
that would test for it.
Exactly, and that helps us diagnose a lot of early cervical cancers or pre-cancers that we can treat and kind of get better outcomes because it's something that we can find early and treat early.
And then what about, I don't really ever hear about vaginal cancer. Would you have cervical cancer if you had vaginal cancer?
Sometimes,
or can you have just one and not the other?
There can be some association. So vaginal, vulvar, and cervical cancers, they're often associated with the HPV virus, which affects that tract. And so you don't necessarily have to have one for the other. And the vulvar and vaginal cancers are much more rare, but all of those things are evaluated by an OBGYN or your family doctor that can do a pelvic exam.